giving a metal piece like a spoon to a person's hand can stop seizures. This is a very common myth which we encounter, especially in Sri Lanka. And I think it's more dangerous to sort of give anything that is metal to a person who's having a seizure because they can injure themselves. Hi everyone, my name is Dr Kishara Goonaratne. Today we're going to bust a few myths on epilepsy. You need to put something in a person's mouth to stop them from swallowing their tongue during a seizure. A big no. This is more detrimental, can cause more problems both to the patient as well as the person who's actually inserting a metal object or a spoon. Please do not do it. You should restrain someone having a seizure. That's a big no. When you see someone having a seizure, the best thing we would recommend you do is just observe. It's important that you make sure that the person who's having a seizure is safe and doesn't injure him or herself. Flashing lights at events or even in video games and movies cause seizures in people with epilepsy. So this is seen with epilepsy, but not in all epilepsy. So it's important to ask your doctor whether you've got photosensitive epilepsy. Photosensitivity is at a certain frequency. It's only certain types of strobe lights and certain types of video games with a certain type of frequency. We would restrict people who've got photosensitive epilepsy. The others have no problem. People with epilepsy have sexual problems. Again, another myth. In most cases, patients with epilepsy, there aren't any problems. Women with epilepsy can't bear children. I think the biggest fear is that women with epilepsy can pass on epilepsy to their children. And I think that is one of the biggest barriers. This is not so. It is seen in approximately less than 5% of the population where people do pass on their epilepsy genes. More than 95% of women are able to bear children. Epilepsy is not treatable. Further from the truth, epilepsy is treatable. Medication is effective in approximately 70% of patients with epilepsy. There are certain patients or people with epilepsy who do not respond to medication, where in certain patients we are able to do surgery to cure them. Epilepsy is a mental illness, so this is a categorical no. This epilepsy is due to abnormal electrical activity in the brain, and the seizures are a result of this abnormal activity and certainly not a mental illness.